right now. And thankfully, Amber remembered to turn on the recording. I was supposed to do that. Sorry, Amber. And the museum is in a good place, both financially and activity-wise, and you'll be hearing more about that. Obviously, we still have challenges to face, and we still need support from our membership and from friends of the museum, but we're doing okay. And we're doing okay in large part because of our volunteers. We have a cadre of dedicated volunteers who have given their time, effort, and devotion to the museum. And as docents, as guides, as supporters, as archivists, as data entry people, the museum is in good shape because of the volunteers. And we could use more volunteers. So anyone here who has the time and interest to volunteer or knows people to volunteer or can give us a link to potential sources of volunteers would be very welcome to do so. Tours have been ongoing and increasing since the beginning of the pandemic, and we're not quite probably where we were before, but we're definitely getting more large groups, in particular school, college, university groups, pretty much of multiple ages. So that has kept the volunteers busy providing tours for these large groups, and we're still getting people arranging for individual and small group tours as well. And a big success have been the campus tours. These tours bring people to the buildings on the Tewksbury Hospital campus that have historical significance and architectural significance. And these tours are very well received, very interesting and informative. And if anyone hasn't done the campus tour yet, I strongly recommend them. This is Paul Constantino who does many of these, most of these tours, I think. The other thing is Liz Robinson, one of our volunteers, has started tours of the Pine Hill Cemetery, which was the major cemetery for the hospital where people were buried in these marked graves. They're marked by numbered markers. And she brings people on these tours. These tours occur on Saturdays in times of years when comfortable to go out on Saturdays. And it's something to keep an eye out for next spring and summer, because this is another extra tour sponsored by the museum that has become quite popular. And genealogical research is also another thing that's going on at the museum, particularly Emmy Thomas, Julia Kinchla, and Ruth McNutt are going through the hospital records. We have admission intakes and discharge records, and people who want to track family members who spent time at the Tewksbury Almshouse or hospital can go online and make requests. And this has provided some revenue for the museum, and I think a lot of interest on the part of people doing the research and the people getting the information that they've been able to uncover. And we've had a number of programs in the last year, particularly during Public Health Week. We had a program pretty much every day of Public Health Week, through the Billerica Woods to the Billerica Smallpox Cemetery, and forums and Narcan trainings, for Public Health Week. And then during the year, we've had book club meetings as well as a program for World TB Day on tuberculosis in children and a program on William Augustus Hinton to close out a grant-funded project that was done by Amber Woods, our museum coordinator, to digitize the records we have from Dr. Hinton's laboratory at the Public Health Laboratory. And there's been a lot of outreach, particularly Amber's been going out to a variety of community events with volunteers and board members and doing presentations and setting up an exhibit at the Tewksbury Library on our patent medicine exhibit. And during the holidays, we had a food drive that people could bring food for the food pantry in lieu of admission fees. We got a new cabinet that Emmy Thomas discovered and Amy Consalvi acquired for us and brought it to the museum. It's now being fitted out to be a exhibit on HIV/AIDS, something we haven't had, and we're working with the Department of Public Health to get one of the AIDS quilts that are currently in the department's lobby for exhibit at the museum, with a variety of other exhibits to remember HIV/AIDS. I think there are fewer and fewer people who remember the 1980s and what it was like before there was highly active antiretroviral therapy. Now, that was the good news. On the bad news, our basement has been flooding in the heavy rains. We're hoping that has been fixed because a hole in this wall has been sealed. So we've gone a couple of rainstorms without a leak, although we haven't had the kinds of rainstorms we had July and early August that really caused the flood. So we're keeping an eye on the basement, and fortunately, not too much of what we had was on the floor. You can see some things were furniture in particular, and some of these frames, but most things were above level. This is the digitized Hinton archive that Amber put together, and it is now available online. And the program we had in July was on the Hinton story, which it has been put together because he was a very private man. He never sort of talked about or published anything about himself, and very little has been published. And what's been published tends to be the same thing over and over again, and sometimes with things that are clearly wrong incorporated. So we're trying to bring together as much information as we have on this very important figure in microbiology, serology in the 20th century. We also got a grant to investigate the possibility of building a space in the basement that would be protected from the environment and would have climate control for storage of our materials, our books, archival materials, the valuable things that are not, don't want to get damp. And this is a work in progress. It's going to cost a lot of money. It may not be possible for us to actually do it, but we got the funding to matching funds to at least explore this potential for preserving our collection. We also have an image library. We have, right now we have probably thousands of negatives and hundreds of lantern slides that one of our volunteers, Pat Kavanaugh, is putting into a database. Among these, this is an example. These are children at the North Reading TB Sanatorium, which was exclusively for children for most of its existence. And this is the sort of the opening of Tewksbury Hospital. And actually, this is literally the opening event for Tewksbury Hospital in 1968. So we have negatives that span the period from the 1940s to the 1970s. And we have lantern slides, mostly from the 1930s and early 40s, that are presentations of data, some of which has been published and some of which has not, including x-rays that have never been published. This is an x-ray of a child being followed for tuberculosis in the 1920s and 30s. This is someone with occupational lung disease from a study that was done in 1933-34. This is a slide from 1940 on a presentation of polio in the city of Boston. This is former Director of Communicable Disease Control and State Epidemiologist Roy Feimster. I never had a picture of Roy Feimster before. And then we have a collection of pictures on the polio vaccine trial as it occurred in Massachusetts in the 1950s. And many, many, many more in environmental health, oral health, MPHA pictures, a variety of things. We're hoping to get digitized and then maybe get funding for making these available online as part of the museum collection. Now I'm going to turn it over to Outbreak. Before I do that, does anybody have any questions about what's going on in the museum now?
Yeah, I have a question. What's your census like? Is it going up, down, staying the same?
I think I'm going to see if Amber can give us an estimate of our people we're seeing per month or visiting per month.
So per month for tours, it kind of goes up and down. So our busiest time is definitely during school. We've had a lot more school groups than everyday visitors. So the census of that is also just younger aged. So our normal census kind of age group for typical visitors are more on the older side. But an average on a busy month, I would say we get maybe 50 tours. And that's primarily with those school groups we arrange with. But on a slower month, we get maybe 5 or 6 just normal visitors, unfortunately. But that's just with the weather, and we don't have our, our cemetery tours or outdoor tours during the winter months.
You said 50?
About 50, if we wanted to average it.
And overall, I think it's similar to pre-pandemic, except pre-pandemic, it was not as many school groups. Paul, did you have a question?
Actually, more of a comment. I think this is very exciting. And I don't know if vibrancy is a word, but it just gives a sense of not just the scope, but the amount of work and the amount of activities is it shows just a lot of life in the institution.
Yeah. I'm going to turn it over to Kathy D'Amoto now, because we have some special guests from Outbreak, and she's going to introduce that segment of our program.
Can I just share my screen to help Kathy?
Yes. Oh,
yeah.
Yes. Kathy Herson is going to be joining Kathy D'Amoto. And Oh, did you?
Oh, yeah. Are you seeing this? Oh,
Not yet.
Okay. I hit shared screen. Shoot. Oh, share. Okay. Oh my gosh. Now I can't find what I had. Oh. Shoot. Kathy, why don't you start? I'll see what I can find. Sorry.
You want me to pull up the slides?
If
I
you
have
don't
them.
mind,
Yeah.
that'd be great. Thank you, Amber. You saved us. Okay. We just start at the first one. Yeah, that's
Perfect.
great. Okay.
Okay, can you hear
Yeah.
me?
Yes.
Okay, great, thank you. All right, well, good evening and thank you for the opportunity to provide a brief overview of 11 years of Outbreak. Tonight, you'll hear from Kathy Herson, and then you'll get some direct feedback from two Outbreak alumni, Terry Clover and Sydney Whittaker, about their Outbreak experience. And at the end, we'll leave a little bit of time for some questions. But just to let you know that Outbreak's first year was 2013 with 12 students. It was a week-long program held at the museum. And over time, we were able to make site visits to the state lab, the Lowell Community Health Center, Worcester Health Center. And so there were a little few trips done. And overall, we always had very positive response from public health professionals. But probably the biggest change came with the pandemic and our decision to move to a virtual program in 2020. But this past year, we scheduled one of the days to be back at the museum and had very positive responses from both the students, the staff, and presenters. And I'd just like to mention that we had Carrie Dunn, who joined the staff for several years as a high school teacher and made some very important links between students and presenters. The program has been sponsored in the past, and we will be seeking new funding sources to continue what we've been doing and explore new areas. Probably the most important aspects of the program is that we ended up learning was from the alumni who returned and volunteered with time and their input. And then when we finally recognized their impact, it was really seeing that they are the future of public health. Now I'm going to turn to Kathy, who can provide you some of the details of what's evolved with the student demographics and topics, and then she'll be followed by Terry and Sydney. Kathy?
Great. Next slide, please. So this picture shows one of the original classes on the right side and then the virtual. And so the course started essentially initially as a 3-day course. It is now a 5 full-day course. The first class had 12 students. We peaked when during COVID when the course went virtual to 60 students. And now that we're getting hybrid and the pandemic is settling down, we seem to have a solid body of students that are attending. The students range in age between 15 and 18. They're high school juniors and seniors, are predominantly female. The Asian population is the largest ethnic group, followed by whites, Latinos, and Blacks. And we're also trying to target some underserved populations to have them attend our course. Until COVID, most of the students, all of the students, except a couple of kids from New Hampshire, actually came from Massachusetts. But since we're virtual, we have students attending from 15 different states and actually one country. In the process, we discovered that there's an unmet need where in some parts of the country, the students have very little access to sciences, and they continue to send clusters of students from these areas to attend our course. Next slide, please. It's hard to cover all of the topics, but the basics are there: epidemiology, pandemic control, outbreak control. The students love the exercises that we do during the course, but we've also included topics that are related to the climate change and health impact because of that. We have refugee health represented. We also have disparities in health and substance abuse. There's just a long list of topics that have been covered over the years, and I'm not sure we could cover them all. It would cover up, several slides. The other thing that the course really does do is if there's a new disease or a current outbreak, a brand new outbreak, it literally is addressed during the course. Monkeypox was one of them. It just hit the news and it was covered in the course. The course is always rated very high by the students. And one of the things the students found is that they were really surprised at how much public health impacts their lives and other professions. Another thing we found is the science teachers and school counselors refer the students to our course for their senior projects. And the other thing is there are schools that have been sending students since the beginning of this course, which says the feedback must have been very positive. Next slide, please. This picture shows many of the classes, the first classes of Outbreak since its beginning. The alumni now are an integral part of the course, as Kathy had mentioned. They're active members of the planning committee. They teach sessions. They assist presenters and co-present. They lead breakout sessions with the students. They advise the students, and they evaluate the course. So it's my pleasure to introduce two special alumni, Terry Clover, who attended the Outbreak first year in 2013. She is now a presenter and a member of the planning committee. She has a master's in public health from Boston University, and she is planning and operating coordinator for the Cambridge Health Alliance and Region 4AB. She teaches the course's emergency preparedness class, and the students love it. And Sydney Whitaker attended Outbreak in 2020. She is now an alumni assistant, which helps with the course, and she's on the planning committee. She's a junior at the University of Connecticut, studying molecular and cell biology on the pre-med TAC. And she advises students and is assisting with facilitating an alumni group. Some of the alumni would like a coordination with the Public Health Museum so they can continue to connect with each other. So I'll turn it over to them. Thank you.
Yeah, thanks so much for the great intro. Like Kathy mentioned, my name is Terry Clover. I was a student during Outbreak's first year in 2013, and I've since gone on to get my master's in public health. So clearly I'm a big fan of the field. But definitely Outbreak was my first introduction to public health. I was not aware of what the field was or what people in it did. So this was definitely my first introduction. And something that really opened me up to a lot of different career opportunities and paths. I think I didn't realize how big of a field public health was until Outbreak, that there's really something for everyone in there, and there's so many niches that you can go into and so many great people to work with. It also provided a great networking opportunity for me. A lot of the people that present at Outbreak now are people that I work with every day at DPH or the Boston Public Health Commission or Boston Healthcare for the Homeless. So I get to work with a lot of these great speakers and alumni who continue to contribute to the program in my everyday work too. So it's just a really great community of folks that want to help people and that want to help shape students and the future of public health. So I really cannot say enough positive things about the program and how it has impacted me.
Thank you.
Great, thank you, Terry. Hi, everyone. My name is Sydney Whitaker. I am a molecular and cell biology major at the University of Connecticut, and I am on the pre-medical track. So I was a participant in Outbreak 2020. That was the first virtual year, and I really had a fantastic experience that year. Again, this was my first introduction to public health topics. I really did not know much about the field at the time. I knew I wanted to do something healthcare related, but I didn't have a specific career trajectory at the time. So I had the opportunity to learn about topics in nursing, global health, refugee health, epidemiology, which were all super amazing. And I felt like I really got a comprehensive sense of the fields from real professionals working in the field as a high school student. So I felt very connected in this community of individuals with similar interests to myself. I had never been exposed to such a group before, and it was really fantastic to be welcomed into that environment. And I also appreciated the opportunity to speak to these professionals as a high school student. That is really a unique opportunity for people between the ages of 15 and 18. That is really unique. I also liked that I had the opportunity to begin networking as a high school student. I've met some really fantastic people through this program and cannot say enough great things. They're really fantastic. I really appreciated that the program was super interactive. We had the opportunity to go through epidemiology case studies. We made final case reports, which are all very relevant applications for my future career, and I'm sure for the rest of the students' future careers as well. So now I'm an alumni assistant, and I love the mentorship aspect of that position. I love working with all the planning community members and sharing my love of public health with everybody else as well, specifically the social determinants of health, which is a major part of my roles at UConn and some of my positions here. So all because of Outbreak, I've had the opportunity to go into orthopedic surgery research. I am a food insecurity coordinator for my school. I am also on the pre-medical track and have found my interests and ways to combine those interests that I learned about and discovered through Outbreak. So I really appreciate the opportunities they've given me and the people I've met along the way.
Thank you. Are there any questions?
How often is this course given during the year?
This is once a year in the summer.
Once a year in the summer.
Yeah. And it's varied a little bit. It used to be 1 week. One time we did 2 weeks. But now that we had to go virtual, as I mentioned, this last year we did do one day at the museum, and everyone was just so impressed how different that interaction was and how important it is to have in-person teaching and interaction. So we're hoping to move back as much as we can toward in-person at the museum. But we don't want to lose too many of those distant people that we've had. So we have to work on this a little bit more as to how to get it all together. Any other questions?
Yes. Hi, Louis here.
Hi, Louis.
Yes, I was very impressed by the alumni, the two presenters, and somewhat different. Interesting how wide public health is to work in a neighborhood, work in for a city health department and investigating homeless, and then also doing all biochemical research and going and thinking about nursing, medical school, and professional level from public health. So it takes a lot of science, and it takes a lot of boots on the ground, which we heard today. I think that was very enlightening, and a real plus for Outbreak as to changing people's lives and changing their career paths and eliminating them. And I was impressed with what Kathy said about our students and our alums become the future of public health. And just in Massachusetts alone, we're redoing a lot of local public health and starting to set up standards for local public health. And we're finding we don't have enough people in local public health. And that's what's interfering with having equity across the state for public health and with the other states in the country. So, just hats off to the presentation on outbreak, well, else as well, but especially this outbreak presentation. Thank you.
Well, thank you. And yeah, we hope to continue the program and have it grow a little bit more, especially supporting the work of these alumni that come back. I mean, Terry's been here since 2013. That's quite a long time of devotion. And like I said, this is the future of public health. Thank you.
Paul, do you have a comment?
Thank you. Yeah, Paul Eckkind, I think, had his hand up.
You're on mute.
Just wondering, this is wonderful. And how large a group can you handle?
Well, the largest group, which was, virtual, was up to 60. And I suppose we could go larger, but I would think our concern is that ongoing need to have direct interaction. And maybe what we would have is subgroups by geographic location, where we would end up having relationships with other schools of public health or public health organizations that could then sponsor a day or two of in-person. But the 60 has been the largest.
Okay, thank you very much. I think this has been one of our premier activities for a number of years now, and came from the recognition that people don't hear about public health. Well, it might have changed actually recently, but people didn't hear about public health until they were well on their way to other career options. And this program is at no cost to the students, so they do not pay anything to participate. And so that's why we're always looking for support for the program so that we can continue to provide it at no cost to the students. And our faculty is a volunteer faculty, and that's how we've managed to get this far. So actually, we're going to move on now to our special guest speaker. Who actually showed me how to do that, what I just did earlier this evening. Dr. Catharina Giudice is an emergency physician who is the FXB Climate Change and Human Health Fellow at the François-Xavier Bagnoud Center for Health and Human Rights at Harvard University. She went to medical school at the University of Colorado and trained in Southern California in LA County and USC. And one could imagine that working as an emergency physician in Los Angeles can give you a good sense of the impact of climate and climate change on health. And that's what she's going to talk about this evening, is climate change and health, with special focus on communities disproportionately affected and the impacts of recent climate-triggered events. By the way, Dr. Giudice was one of our faculty for Outbreak this summer, and got rave reviews from the students and all of us who are listening in. So thank you for joining us, Catharina, and I'm going to stop sharing my screen and ask you to share yours.
Yeah, thank you so much, Al. Thank you for the kind introduction. You guys can hear me okay?
Yes.
Awesome. Just bear with me for 1 second. Al, how's my screen?
That's it. Perfect.
Yeah, all right. Let's get going. Guys, thank you so much for having me. It's a pleasure to be here. Like Al mentioned, I was invited to join Outbreak this year. I think it's so cool and so important that the topic of climate and public health is being added to the curriculum. In my personal opinion, I think it's one of the biggest public health crises of our generation. And I'm going to share with you why I think this. Al asked me to focus today's presentation on current events, which sadly it's very easy to do because I feel like every month we've seen some disaster that is somehow tied to climate change. So feel free to throw questions out there. Hopefully we'll have a few minutes at the end for a few questions. But just to introduce myself, like Al mentioned, my name's Catharina. I'm an emergency physician. I did my medical school in Colorado and did my emergency medicine training in Los Angeles. I trained, as you guys can imagine, during a really difficult time for public health. It was the middle of the pandemic. So I was caring for patients that were very vulnerable, very underserved in one of the cities in the country that got most affected by COVID. You can imagine how strained the healthcare system was in the midst of all of that. And climate didn't care that COVID was going on in the world. We still saw some of the worst heat waves that we've seen in SoCal history. We still saw some of the world's worst wildfires that we've seen in SoCal history, and that put an additional strain to a system that was already in the verge of breaking. I was already interested in climate change, but really realized at that time how impactful it was for patients, especially people that didn't have the resources to adapt. Now I'm a fellow. I'm doing a climate change and health fellowship, as Al mentioned, at Harvard, with dual affiliation at the School of Public Health. So allow me to share with you why I think this is so important. So I feel like in the last, we've known about climate change for a long time. The science has been there for a long time. People have been ringing alarm bells for a long time. And growing up and in my early school days, I feel like the framework that people always had to talk about climate change was this image of a polar bear in the Arctics. And the messaging that we had as a society was, we are emitting greenhouse gases, it's heating up the planet, and it's ruining the ecosystem and the environment and the living environment for these animals that are so far away from where we live. And it never had a real tangible impact for us. It was always something that was happening far away. And I think that's been changing a little bit in the last couple of years, especially in the last 5 to 10 years. The conversation has shifted, and we're starting to really frame climate change as something that's happening in our own backyards. It's happening to us. It's affecting public health. It's not the polar bears up in the Arctics. It's our neighbors. It's our community. We are being the ones affected by climate change. And that's why I care so much about it as an emergency physician, because I see it day in, day out, how climate change is affecting the health of my patients. So the framework that I want to propose to you guys today is this one. Climate change is affecting human health. Climate change is a public health crisis. Before we get started, before we go too deep into the talk, I know that the science has been out there for a while. I think fortunately, even though the topic is still very politicized, I think there's very little debate on what the science actually is. But just to make sure that we're all relatively in the same page, basically what's happening is, and we have amazing, great data from a million different sources that are basically saying the same thing. The carbon dioxide level of the planet has oscillated over the last however many years Earth has been around. The really great data we have goes back 1 million years, and this is from ice core data, where they drilled really deep into the Arctic, and they were able to analyze the CO2 bubbles retained in these ice cores, and they correlated with what the atmospheric CO2 was when that ice formed. So we have this amazing data showing us that yes, the Earth's CO2 has fluctuated up and down over the last 1 million years, and that's a natural cycle. But what's not natural, it's what's happening in the last century. So I'm going to bring your attention to the far end of the graph. So starting in the 1700s, Industrial Revolution happened, mechanization, new technologies. We're learning how to burn fossil fuel and produce this robust amount of energy. It allows for populations to bloom, for agriculture to bloom. And we had this rapid surge in CO2 levels that were completely unprecedented from anything we've seen in historical data. So what this means basically for us now is CO2 is a greenhouse gas. So it's one of many greenhouse gases. It's probably the most important one that's leading to climate change. And it acts as a blanket around the Earth. It doesn't allow heat to escape very easy. So the temperatures globally are becoming hotter and hotter. It's melting the ice, which usually reflects light. And if less light is being reflected, that energy is being absorbed by the ocean. So you have this self-perpetuating cycle that is leading to really profound increase in global average temperatures. So let's jump into the actual content. Like I mentioned, obviously today we're going to be talking about how climate change is affecting human health. And again, Al asked me to share some examples of kind of in our modern history in the last few years, some of the climate disasters and how they're affecting communities. And I actually chose just to focus in this last year. So I'm going to take you guys through a journey starting January of 2023, and kind of some of the few examples that have been happening just in the US. We don't even have to go beyond our borders to really see the impacts of this. And before we dive too far deep, I just want to highlight a caveat, and that it's very difficult to actually attribute events to climate change. So it's very difficult to say a hurricane is happening because of climate change. There's not a big enough N to be able to make that attribution. But we know that climate change is increasing the energy of our planet, and it's affecting weather systems in pretty profound ways. And what we do know is that events that were historically 1 in a 100-year occurrence are now happening very frequently. They're happening every other year. They're happening every few years. So as we go through these examples, I just want everybody to be on the same page that we're not attributing them necessarily solely to climate change, but climate change as an exacerbator for these events. Does that make sense? So we're going to start January 2023. This is back in my hometown in California. We had a mega flood. We saw 400 to 600% above average rainfalls in the span of 1 to 2 weeks. California is known, as you guys know, as a drought state. We don't get a lot of rainfall. A lot of our agriculture is there because we artificially irrigate our crops. We don't get a lot of rain, and we don't have an infrastructure to withstand that rain. So this was pretty profound. We typically don't see events like this happening. It led to 22 deaths, 200,000 homes lost power. Over 6,000 people got evacuated and displaced from their homes. What's interesting, the reason why climate change is causing events like this, you can say like, yes, it's great that California is getting so much rain and supplying some of the water sources. But the way that climate change is causing this is that it's basically absorbing the the hotter oceans are evaporating more. So you have a lot of moisture that's concentrated in the atmosphere. When that moisture moves over land, it just precipitates, and it's not this like nice gradual rain that replenishes water supplies. It's this torrential rain that basically just completely devastates infrastructures. Anytime you have just downpour of overcapacity water, you can imagine how floods can destroy homes. It displaces people. It can cause direct injury from drowning, people that get injured from drowned objects. You can imagine how this oversaturates the sewer systems, and then can lead to spread of infectious diseases, infectious diarrhea, soft tissue infections. In my opinion, I think one of the most profound effects of events like this is that usually cities lose their power for days to weeks. It's really difficult to restore infrastructure. So what happens to people that are dependent on electricity in their homes, people that need electricity to maintain their medications cool? What happens to people that need home oxygen? They need their electrical supply. What happens to people that are dialysis dependent? Like, you have complete disruption of healthcare delivery that can take quite some time to restore. So you can imagine how profound the health implications of events like this can be. Moving on a little bit further in time, March of 2023, Canada saw its worst wildfire in recorded history. This fire burned for months. It burned a total, I think now the count is 44 million acres burned. To give you guys some perspective, that's about the size of the state of Florida. If you haven't been to Florida like myself, it's about 6 or 7 times the size of Massachusetts. Massive territory that was burned. And we're seeing unprecedented fires like this everywhere. California has just been seeing increase in the severity and surface area burned year after year. The same thing is happening in Washington, in Montana, in Colorado. It's, again, a lot of these effects of climate change are very complicated. Some people say that you have decreased soil moisture in combination with plants that grow better during the winter because you're having more rainfall and more torrential rains that then fuel more growth. These effects are very complicated, but what we're seeing is the increased severity of wildfires, increased frequency, and area burned. People that live by wildfires, you can imagine how much that affects mental health of people that need to be evacuated, people that lose their homes. When there's enough time for evacuation, I think we can prevent a lot of the injuries. But we see numbers of people that are being directly affected with burn injuries. And there's a huge displacement of large portions of the population that then saturate healthcare systems in other areas that are recipient of that movement. So you can imagine, again, how those disruptions in healthcare system can have pretty profound health effects for people, especially people that have chronic medical problems and are dependent in their regular healthcare access. Climate change does not respect any borders. So this is an image from New York City during the Canadian wildfires. The massive smoke migrated. We saw it here in the Northeast. It was around for weeks. You can imagine how that caused quite a surge in respiratory exacerbations, asthma, COPD. What's really interesting about climate change is that it's not just the air pollution from wildfires that is profoundly detrimental to health, but it's also just the sheer quantity of these particulate matters in the air that are a consequence of burning fossil fuels. Just that air pollution by itself is incredibly detrimental. So you don't have to be near a wildfire to be affected by this. We see just from increased particulate matter levels, we see, like I mentioned, increased exacerbation of respiratory diseases, exacerbation of cardiovascular diseases. There's a lot of really great evidence that the allergy season is also expanding its range and becoming more severe. So people that have asthma, that have allergic rhinitis, allergic conjunctivitis, all of those things are becoming more frequent and more severe. And you don't have to be close to a wildfire to be affected by that. Moving forward a little bit more, June to August of 2023, NASA declared the summer of 2023 the hottest on record. This is an image of the last 100 plus years, the average summer temperatures, kind of just showing this pretty obvious and devastating trend to hotter and hotter summers. I think heat is probably the association that is easiest to make between climate and detrimental health outcomes, for obvious reasons. Obviously, hotter days are gonna lead to increased risk for heat illnesses. So especially in areas that are not prepared, that are not adapted to withstand higher temperatures, we see a lot of increases in folks that come in for heat exhaustion, for various types of heat stress, dehydration. And on the other side of the spectrum, there's a condition that's called heat stroke, where when people are exposed to elevated heats for a long enough period of time, their proteins just start denaturing, and the mortality for that is 50 to 80%. It's incredibly high. So those are kind of the direct correlations of how heat can lead to worse health outcomes. But what's really interesting about heat is that there's a correlation with increased incidence of almost everything during heat waves. So when I was practicing in LA, for example, I was in a level 1 trauma center. And we saw people that came in with penetrating trauma, gunshots, knife wounds. We saw people that were in car accidents. LA has a huge freeway infrastructure. And during the heat, during the summer months, we knew that was the time to work at the hospital, because you were going to see some of the craziest cases come in, because there's just so much more volume of injuries during hotter days. We saw worsening cardiovascular disease. We saw just increase in hospital volumes and increase in all-cause mortality during hotter days. Moving on, August, just a few months ago, I guess not even that, August 2023, Idalia flooded parts of South Carolina and Florida. It left 150,000 people without power in Florida, 150,000 in Georgia, almost 40,000 in South Carolina. And like I mentioned, similar to kind of the infrastructural damage that we see in floods, same thing happened with hurricanes. Obviously, you get high flood waters in some areas. You have pretty devastating impacts to the electrical infrastructure, to road infrastructure, to sewage infrastructure, and people that depend on those things to be able to get their health care and stay healthy. It can be pretty devastating. And sometimes those disruptions in infrastructure can take days to weeks to be able to be restored. The mechanism in which climate is causing hurricanes, like obviously we've seen hurricanes for a long time, especially Florida, the Caribbean. It's not something new. What is different though is that because the ocean temperature is hotter, the energy from hurricanes comes from that hot water in the oceans. So we're seeing hurricanes that are becoming Category 5 hurricanes faster than they ever have. Because of the water temperatures being higher further north in the mid-latitudes, like even up in the Northeast, now we're seeing the trajectory of hurricanes change and start affecting communities that are further north than communities that have been historically affected. So we're seeing an increase in the frequency and severity of these hurricanes. Like I mentioned, again, similar to floods, you can have the direct impact of the hurricane, so people getting injured from the winds, from drowning, from spread of infectious diseases. And usually the mortality of hurricanes is based on kind of those acute events. But like I mentioned, the really profound effect on health comes from that really long tail of mortality that stays for weeks to months because it takes so long to restore infrastructure. So what happens when wildfire meets hurricane? We saw it in the devastating Lahaina fires again in August. And here's a good opportunity to pause and remind ourselves that we're not saying that climate change is necessarily causing all of these events, but maybe it's making them a little bit more likely to happen. Could this have happened without climate change? Maybe. We don't know, and we're probably not gonna be able to get answers anytime soon. But what happened in Lahaina was unprecedented. It was, I'm sure everybody followed the news and heard stories of people describing these winds that were so hot and so unbearable. It was literally a fire hurricane that spread so quickly through Lahaina and devastated an entire community that didn't have time to evacuate. And it was one of the most deadly wildfires that we've seen in recent history. Again, California, again, a lot of rain in Southern California. Not a typical place to get hurricanes. Could this be attributed to climate change? I mean, there's an argument that this direction in which the hurricanes are moving is changing because these profound changes in weather pattern and ocean temperatures. It ended up costing California $60 million in insurance losses, even though it was downgraded to a tropical storm. Just a month later, I think we all remember, it wasn't too many days ago, there was the threat of Hurricane Lee kind of hitting the Northeast and making landfall in New England. Again, what's unique about Hurricane Lee, fortunately, it didn't have substantial infrastructural damage consequences, but it was a hurricane that intensified so quickly from a Category 1 to a Category 5 within 24 hours because the oceans are just getting so much hotter. And again, it made that trajectory up north, which is not very typical because of the hotter waters kept fueling that energy of the hurricane up north. I know I shared a lot of bad news already, and I think it gets a little bit more complicated. The effects I think that I've shared so far are a little bit easier to understand and wrap our heads around. I think that there's a lot of like the true devastating impacts of climate change on health are so profoundly complicated and so difficult to quantify. For example, we know that communities across the globe, let's take our neighbors in Central America in the dry corridor, Guatemala, El Salvador, Honduras, we know they've been going through a multi-year long drought. A lot of the families in rural areas are sustenance farmers that are losing their crops year after year. What does it mean for those communities? They're losing their crops. Are they going into food and water insecurity? Is that triggering migration? Is that triggering displacement? What about the mental health impacts to the communities that are being displaced because they can't feed their kids, because they can't make a living? The picture that I have back here is of Syria, ongoing war that has devastated the region, killed thousands of people. Some people make the argument that there was a climate trigger to the Syrian war. Syria has, in the last decade, has been going through one of the most devastating droughts in its history. A lot of, similar to what I just mentioned, a lot of crop failure that led to food and water insecurity in rural communities and had a massive displacement of these rural communities into urban centers that were already very unstable from a socio-political standpoint. So some people argue that, maybe there was a little bit of a trigger that could be attributed to climate change. It's a very debated topic and honestly very difficult to really quantify. But I think some of these unquantifiable effects are some of the most profound to our communities and to communities around the world. Are you guys with me? So switching courses a little bit from all of these devastating environmental events. I think maybe some of you have seen this graph. It's directly from the IPCC report, which is the gold standard scientific report that comes out every few years, kind of summarizing the state of the best science we have on climate change. The graph kind of models what the temperature has been doing over the last century and what the projected temperatures are. We, as a globe, made a optimistic agreement that we were going to try our best to limit our average temperatures to 1.5 degrees Celsius increase. We've already blown past that opportunity. But every degree matters. If we continue business as usual with the same level of emissions, the net temperature change could be as high as 6 to 8 degrees Celsius, and that would be absolutely devastating. So every degree, every effort we make matters. Every degree we are able to prevent is going to have a substantial beneficial effect to health. So how do we do that? There's, in the climate lingo, in the climate world, there's 2 ways to respond to this crisis. There's our ability to mitigate and our ability to adapt. Mitigation is basically stopping the process of climate change. So stopping usage of fossil fuels, stopping emission of carbon dioxide and other greenhouse gases, and therefore stopping the process of global warming. To give you guys a little bit of perspective of the impacts of healthcare itself as its own economy in the US, it emits about 10% of greenhouse gases. So it has a huge contributory effect to the problem. And it's in this interesting position because we're also seeing a lot of the health impacts. We're the ones responding to it, and we're the ones contributing to the problem at the same time. So there's a lot that we can do even within healthcare and public health, mostly healthcare, to kind of minimize our impacts, but a lot we can do as a society to rapidly stop the burning of fossil fuels and turn to regenerative energy. On the other side of things, I think one of the things that is going to become more real and more important as the years go by, acknowledging that we are already committing to at least 1.5 to 2 degrees Celsius of temperature warming. And we're already seeing a lot of the impacts of climate change, even nowadays, is adapting. From a healthcare standpoint, there's a lot we can do to protect our communities, to make sure our healthcare systems are robust, that we're prepared for these events, that we have evacuation plans, that we have good alarm systems, that we have infrastructures that can withstand and maintain operational status during a lot of these events. There's so much we can do and so much that we need to be doing to prepare for what we're already seeing. One of the nice things about addressing climate change is that a lot of the mitigation strategies also have what we call co-benefits to health. So implementing strategies like stimulating people biking to work, obviously that decreases usage of gasoline, cars, and decreases fossil fuel carbon dioxide emissions, but it also improves cardiovascular disease. Working on decreasing CO2 emissions in a variety of ways also decreases air pollution, therefore improves health. There's a lot of co-benefits. Addressing one thing has the potential having dual beneficial effects to the health of our communities. This is a list of organizations, particularly in healthcare, that have been very active in the field. There are a lot of players. They're working very hard, and they're gaining quite a bit of momentum in the last couple of years. So I think there's a silver lining of hope. Some of my references for further reading, and I think we're about reaching our time limit. Please do stay connected. Thank you for your attention, everyone.
Thank you, Catharina, for a wonderful presentation. And I think everyone can understand how the students appreciated your participation in Outbreak. And I'm sure that the members here tonight are similarly impressed and pleased. And if you could unshare, we can get everybody back.
Yeah. And I'm happy to take any questions or comments.
Louis Faison has his hand up already.
Okay, thank you very much. Wow, great presentation. I just love the images to get away from the polar bear and just see this, it's already here. And my question is going to be about the effect of growing crops and possible famine and migration. But I also wonder if you could mention what impact war has on the climate change. You seem to have quite a few wars going on, and we have been warring for a long time. Thank you.
Yeah, gosh, those are huge topics, right? The climate change and how are we going to feed our growing population that's going to reach 9-10 billion people in the next century. Agriculture is, something that is resource intensive, that emits a lot of greenhouse gases in its own right. It's a process that needs fossil fuels for fertilizers to be able to grow the quantity that we need to feed the population. And at the same time, climate is going to make it so much harder. Climate, droughts, floods. My family is in farming in San Diego, and they lost their crop 3 years in a row because of unprecedented weather events in Southern California. So how are we going to feed these many people and communities? And the US, fortunately, we have an incredibly robust infrastructure. We have incredible resources. We're probably not going to be the ones that are going to be affected initially by this. It's going to be communities in Central South America, sustenance farmers, communities in Asia that don't have the resource and the technology that we have to be able to adapt. How does war affect it? How does climate affect war, and how does war affect climate? Gosh, I don't think I have an answer to that. But I can see where your mind's going. I think your argument is that war itself is an incredible usage of resources, of destruction, the resources that we're going to need to reconstruct those societies after the fact. Yeah, I guess I don't have an answer to that.
Well, just one quick point though to get to maybe is nuclear energy and nuclear war. That you start to think about nuclear and the role of nuclear in our future as maybe a clean energy source, but maybe not. I'll leave that.
I'm not sure I'm the best expert to comment on that.
Yes. Okay. Let's let that go. Thank you. What you did was wonderful. Thank you.
Thank you.
Aaron, you have a question? Comment? You have to unmute yourself.
You mentioned that the US contributed about 10% to global warming. How about mainland China?
So the healthcare system in the US contributes to about 10% of greenhouse gas emissions nationally.
Okay, no, nationally.
Yeah.
So,
yeah, the US is a much bigger contributor.
So internationally, how much does the US contribute to global warming, say, versus China or any other major country?
Gosh, it's the US and China are pretty comparable with their historic emissions, I believe. I don't have the numbers off the top of my head, but they're number 1, 2.
I had heard
They're
China was more than the US, but I don't know.
I
what the-
think, yeah, I don't want to misquote the data. I think maybe it surpassed the US in the last couple of years, but for the vast majority of history, I believe the US has been number one.
So you're saying that the healthcare system in our country contributes 10% to global warming of the US's global warming.
Of the US, it contributes more than the UK. The healthcare system in the US contributes more greenhouse gases than the country, than the United Kingdom.
And that's related to what? Heating systems?
It's related to heating, hospitals, all of the resources that we use for all types of procedures, processing of waste. Waste from hospital has to be processed in very energy intensive ways. The transportation associated with getting patients from to hospitals, staff from to hospitals, our EMS system or ambulances. It's very complex.
So what's the major contributor to global warming in the US? What sector of
what industry? I think it's transportation. I think
that would be good to know. If healthcare is 10%, there must
what
be
is the
a sector that's much more than that.
Yeah, those are great questions.
And the public health community represented here tonight may want to know that Myron Alukian has received another honor. He was the president of the museum when the museum opened, but he is being inducted into the Wrestling Hall of Fame.
Not as a wrestler, as an outstanding American. I wrestled, but
Not for a while.
I did well.
Not for
but
a
I was
while.
fantastic.
In a while. Any other questions, comments? That was a brilliant presentation. Thank you so much.
Excellent. Very good.
Very kind. Thank you, Al. Thanks for having me, everyone.
Thank
Come
you.
again.
Now, we go on to the business. The business is very limited. Basically, you heard what's been going on at the museum for the past year, and especially about outbreak, and the membership of the museum. And you know who you are if you paid your dues. We're not going to check, but one of the duties of a member of this corporation is to elect the board, and then the board goes on to elect the officers. And we have 3 cohorts of 3-year term board members. And in the past year, since the last annual meeting, there were interim appointments of Adam Bispham, Kathy Herson, David Paquette, and Saramer Sanchez, who need to be endorsed as official members of the board at this meeting, and then the re-election of Bikash Verma as well. And I would ask for a motion to elect a new board members, and
I'll make a motion to approve the slate.
Thank you. Second?
Second the motion.
And I'll ask, essentially by acclamation, and the next order of business will be nominations from the floor for the board. But anyone opposed? Hearing none, I'll now open it for board nominations from the floor, if there are any. And this is an open invitation to all of the supporters of the museum. We want to diversify our board in every possible way in terms of not only demographics, but also socioeconomics, expertise, et cetera, et cetera, et cetera. So if you do know someone who you think would be a good member of our board, or if you want to volunteer to be a board member yourself, please let me know.
Al, this is Scott. I have a question. I thought Dr. Sanchez, in a previous email, you said that she was stepping off the board.
Yes, I spoke to her over
So
the
is she
weekend.
still going to be on the board?
I spoke to her
Okay.
over the weekend at the infectious disease meetings, and she's going back and forth from Puerto Rico and
Cool.
would still be willing to participate, especially since most of our meetings are virtual. Great, and that completes the official business of the annual meeting. And the other agenda items people would want to bring up.